so we're going to get started. Again, thank you for joining us. Um, I am Brian Tully of Tully Law Group, and we are fortunate today to continue on with our Navigating Your Second Half webinar series, where we talk with professionals in the elder care field about their business, their services, how they help families. And today we are fortunate to have with us Charles DeFranco. Charles is the Director of Outreach and Business Development for Valucare, which is a home health care agency here on the island. Charles himself was born and raised on Long Island, even attended C.W. Post University and received his bachelor's degree in business management and social work, which is kind of a little bit of a foreshadowing for him. And then he received his master's degree in business communications. Before he started with Valucare, though, he was a national sales director for a major clothing company in Manhattan for nearly 20 years. About 8 years ago, he changed direction and entered the healthcare sector and joined Valucare Home Healthcare Services. Charles focuses on helping families navigate the stressful, and those of you that have been involved with elder care issues, you know the stressful task of home health care and all the issues that surround that. Every single day of the week, Charles is faced with different difficult questions, such as which MLTC, and we'll explain that in a little bit, is the best fit for the family? Can Medicaid help? Is there a potential eligibility for Medicaid? Which caregiver will be the best one for our loved one in the family? And they're all difficult and they're all stressful for both the patient and the family. And that's what he does. He helps the family make the best choices as they travel down that elder care continuum. So Charles, again, thank you for joining us. Let me stop our share here. It's a pleasure to have you.
It's a pleasure to be here, Brian.
Good, thank you, thank you. So as I was just doing the introduction there, I saw, there's a difference, subtle, but there's a difference between helping the client, helping our client, for example, or helping your patient, and sometimes what the family needs. So talk to me how, and we'll get into more pandemic stuff in a little bit, but tell me about yourself. Tell me about Valucare, the services that you provide to New Yorkers, and then kind of get into how do you really deal with, navigating what the patient needs, what they want, what they don't want, and so forth. So a two-parter to start with.
Sure. So I'll make it brief with the history of Valucare. They've been in existence for 24 years.
Mm-hmm.
The business plans were actually developed in the basement of a basement apartment from the four founding executives of the company. So it's a very humble beginning. So
Mm-hmm.
they started from nothing and they grew a fantastic community-based company right here in Hempstead.
Mm-hmm.
And we have an office in Brooklyn as well.
Got it.
Valucare provides home health care aides.
Mm-hmm.
They provide nursing, LPNs, and RNs. And I'm proud to announce that we just relaunched our school. We have a school in Hempstead where we train the HHAs.
Mm-hmm.
So through that school, we do reach out programs for the communities to try to get people involved to become HHAs or get involved in home health care.
Mm-hmm.
Just an example, right now we just solidified the contract with the VA, and we have an outreach program with the VA to hire VAs to take care of VAs. So it's a very unique program in the sense that the VA also extends their benefits to the family. So the wives can work, the kids have the benefits for it. So the program what we're launching is to hire the VAs, put them through our school, and then send them out into the communities to service the veterans. So
right. So you're actually looking to hire veterans as well.
Correct. So not only to service the veterans, but also to hire them, get them back into the workforce, give them a hand, those coming out, right?
Yeah.
Very unique program.
Good. No, it is unique, certainly, and well worthwhile, I'm sure. Good. And we'll talk a little bit more about the school as we go.
Sure.
But when you get a call from a family or a referral from another a law firm or a financial advisor or a CPA, what are the first steps that your organization takes? How do you get into the house? There's an assessment. The focus, of course, is the patient themselves, and then secondarily, it's going to be the family. So talk about how you navigate the patient's needs. How do you get involved?
So let's take the example of our work with you. Okay, we'll go that way.
Sure.
So your team is fantastic, I might say.
Thank
The
you.
girls really do the assessments and then will forward it to me. Before the assessment's done, I will talk to your office staff and talk a little bit about the case and what their needs are. And then they do the assessment, it gets turned over to us. First thing I do is reach out for the patient's family. Usually it's the patient's family more than the patient.
Okay.
But I try to always include the patient because it's their healthcare, right?
Of course.
So, so we first deal with what is expected. What are you expecting from this? Meaning the family. Expectations are everything. So we need to understand and explain to them that we're here to service you, and we're here our first concern is the patient, taking care of the patient's needs. Second, we also recognize that the family is just as important as the patient in the sense of they're dealing with this every single day.
Right.
So our job is to make sure that the care of the patient's taken care of, and also the needs of the family so they can go out and work and take the stress off of themselves.
Right.
Okay. So expectations is everything. So I first explain what an aide does. An aide is not a nurse, an aide is not a doctor, an aide is to assist for the daily routines of what the patient needs, hygiene or whatever it may be.
Can you share what those are? Go through those a little bit, Charles. So what are those activities?
So basically the aide is there for hygiene, making sure showers are taken, making sure that they're kept clean, the area that they sleep in is kept, the sheets are changed, their laundry is done, light vacuuming, light housework if necessary.
Right.
The aide is there to remind the patient to take the medication. Now the aide cannot administer the medication, but they are able to make sure that at certain times that the patient is taking the medication. The aide is there to assist in any way possible, getting
dressing, walking, those
dressing,
all those ADLs,
toileting, etc.
Got it.
The whole idea of the aide is to make the patient feel whole again, not to so much depend on the family they may not want to exhibit themselves in that way to the family. So it's much easier to do it with an aide.
Sure.
So really, it's to bring the humanity back to the patient that maybe felt as though they lost some of it through their illness. So the aides are taught if the patient does not take their medicine, refuses it, this happens all the time, they call our agency, and our agency will then contact the doctor or the family member. So we're right on top of it. So they're trained for that. As far as the family goes, it's important for the family to have expectations that are real. Again, they're not nurses, they are not doctors, and that the family needs to be involved in the care of their loved one as well. So it isn't just taking your family member and not being interactive in the daily care of that family member. They need to be active as well. We try to lessen the burden from them, but they need to. So realistic expectations are really the key here. Understand what your needs are. Understand if a family member, what times you're going to need an aide and where a family member could be, because there's nothing like a family member taking care of a loved one. For the loved one, okay? So that's important. So when you enter this, enter it with the knowledge of seeing what is it that I really need. Do I need an aide to be here all day long? Do I need an aide to start at 10 o'clock, 8 o'clock, 7 o'clock, 3 o'clock, whatever it may be? If a family member is home and they need to be to work at 9 o'clock, they want the aide to start at 8 o'clock. I get it. Okay.
Sure.
So these are the things you need to figure out and navigate what it is you really need. So with Valucare, we send out for an assessment. So it comes from you to me. We go through the expectations with the family and the member. And then we do our evaluation. So it starts out with a vetting process. So just like your girls do a vetting process, one of our nurses call over to the patient's family. We ask them the questions that we just went over. What time do you want the case to start? What is it exactly? Are there any special needs, any special diets, anything that we should be aware of? Are there dogs in the home? Is there smoking in the home? Is there anything that we need to know prior to sending in
Good.
the home health care aid? Once it goes through that process, it then gets the MLTC,
which we'll get into in a
we'll
minute.
get into later. Your firm will then recommend the MLCTCs to your clients. They will then call. I will take the information from them, and they'll send over what's called an authorization. So basically, the authorization is authorizing Valucare, any agency, to service that patient.
Perfect.
Once that's done, it gets logged into our computer system. We work off a base computer called HHAX. It's an excellent system. And then a coordinator is assigned, and an aide is assigned, and then a nurse is assigned to go out and what's called open the case.
Understood. Okay. Good. So that's actually a pretty good overview of what your agency does and how you get involved. I will say I love the idea of making the person whole. That is a fantastic way to address it. From our perspective, we agree with that entirely. And you're referencing our care coordinators. So on staff, we have care coordinators. They are geriatric social workers with years and years of experience focusing on the elder care aspects of advocacy and coordination of benefits. So yes, when we're working with a care-based client with what we call our life care planning services, one of our coordinators or advocates are certainly the ones doing those initial assessments on our behalf and helping to coordinate the providers such as Valucare. So yes, good. That's how it works. Now, if I may, though, you mentioned hours and time. So sometimes we'll have a client saying, listen, well, I need 2 hours in the morning and 2 hours at night. And we'll be quick to share with them, it's very difficult to do something like that in aid and transportation. They need blocks of time. So what can you share about the minimum amount of time that you can provide and the blocks of time and spacing throughout the day?
So when we have a client that needs what's called the split day shift, they need some hours in the morning. So basically, I'll speak to the family member and they'll explain to me why they need that. So again, we're not going to get into too deep in this, but because of the situation that the healthcare agency is facing today,
somebody's phone,
facing today. Sorry.
It's okay.
The aids are scarce, so we have to utilize what we have to the fullest. Here at Valucare, what's good about what we do is we have a transportation. We run our own in-house transportation company. So for the aids that are going out to Suffolk County, it's very, very hard to service Suffolk County. We have one of our directors of transportation is sitting with me right now, and we manage to get the aids. So if we've got to bring them in from Queens or Brooklyn or Nassau County because public transportation is so hard. So we can be somewhat flexible with the hours, but the split shifts right now are very hard. So to answer your question, I try to advise the patient to get a family member involved for that in between, or cluster the hours together and then let the family member take the hours that an aide cannot go there. So that's what we try to do. It doesn't work all the time, not all the time, but we try.
Good. So let's change gears a little bit. Let's talk about the last 14, 15 months.
We need to.
And unfortunately, pandemic, COVID has changed the landscape of elder care, of home care, of facility care. So from your perspective, being in the home care world, a lot of changing times. So talk to me. So pre-pandemic, during the pandemic, now that, Lord willing, we do appear to be post-pandemic, how has your company dealt with it? How have the families been able to handle it and make it through?
So prior, it was pretty, what we always thought it's a hard industry to begin with, right? So, but we didn't realize really how hard it could be until the pandemic hit. So one of the challenges with the pandemic is we really didn't understand the pandemic because we were getting so much information from the CDC, from the state. It was changing constantly.
Good point.
We had to adjust. But the pandemic didn't only change for the client or for the patient, it changed for the aides. Because not only did the patients not want the aid service
Yeah.
because they were afraid, so they were canceling out on the aids, but the aides were afraid to go. So
Yeah.
education became a very big part of understanding what we're dealing with and understanding how to protect the patient and the aides, right? Because we got to protect both of them.
Yep.
So the first few months of it were kind of scary. We didn't really know which way to turn. We were watching to see, and then finally we took it in control, and we started to monitor the aides ourselves, making sure that the aides, before they get into our transportation, we do a survey for them. We take the temperature.
Right.
We had made sure that they had all the PPE that they needed to go to the cases.
Yep. Everybody had to be protective.
They did. So as it started to lighten up, what we found that the shift was the people who did not want to leave their loved ones in the facilities. They wanted to pull them out of the facilities. So that was a challenge as well, because everyone is moving to pull them out of facilities. The facilities wouldn't let them leave. And when they did leave, now the challenge is we're sending aides into the home that they were just in a facility, right? So it's kind of reversed. So, but we managed to navigate through that. And CDPAP, I don't know if
consumer-directed program,
yes, became very popular in a very short period of time. It was popular to begin with.
Yeah.
More people were apt to use it because people were staying home and working from home. So the CDPAP program actually played a big role in giving patients services that they wouldn't currently have through an aid.
Good.
So we were able to navigate and promote the CDPAP program to give the patient the. Things are changing, but things will never be the same as they were prior.
I agree with that in a sad but true kind of way. As I said, the landscape has changed entirely, and we're aware now of more challenges. We're aware more of our weaknesses or our weaknesses in the systems, and hopefully we're able to fill the gaps and learn as we move forward. With all tragic events, we want to learn and move forward. So you mentioned earlier the idea of an MLTC. Tell me what that is for our viewers, and what's the process? How does that work, and how does that fit in with what you do? So
it's called managed long-term care.
Yep.
That's what it stands for. So an MLTC is basically, I'm going to simplify it. It's like an insurance company, right? So they go directly to Medicaid. Then Medicaid, it gets approved.
Yep.
And then once it's approved, then the customer, in your case, or the patient, gets to pick what's called the MLTC. So it is very important to understand how the MLTCs work. So the MLTCs don't want to give you a lot of hours. That's just the way it is.
It is.
So when someone new coming in, and this is, I say this because anyone that's out there listening that is new to Medicaid coming in, they can't get discouraged with the first stages of this. They need to understand that it works in stages. And when you have people behind you, such as your firm and what we do here, we will get them where they need to be, but they need to be patient in getting there. So the MLTC plays a critical role in your care, in the care of the patient.
Yep.
So picking the right one, it's just not a matter of sometimes who gives you the most hours. So someone gives you an extra hour, I'm going to go there. Well, what do they offer? So when you're picking an MLTC, or you have people helping you, ask the questions. What do they provide for me? Why do I want to go to that MLTC? We have MLTCs that do everything. They have in-house, they have not in-house, but they have in-network doctors. So everything, when you join them, all of that is included. They provide transportation to your doctors, to your visits. Not all of them do that.
Right.
What do they give us? Do they give us medical equipment, Hoyer lifts, hospital beds? These are the things that we need to understand when we pick the MLTC. And accessibility. So accessibility is very, very important. What good is getting that extra hour if you can't talk to someone in the MLTC, right?
Great point.
So, You need to be able to communicate. You have questions. You're new to the system. You're new in here. You do not know. So you need people who are going to really sit and take the time to answer your questions. So when I say pick your MLTC, ask people about the MLTCs. Ask friends, neighbors, whoever you may be involved with that are involved in this. Ask your office staff. Those girls know the MLTCs, and we talk all the time together, which is the best one for which patient in which area.
Right.
Very important. But I will say this too, Brian, it's very important as well when they pick a home healthcare agency. So it is not hard to get cases and send aides to cases. It is not hard to tell a patient, don't worry about it. We're going to send you the aide. Don't worry about it. What the patient needs to understand is that we all do pretty much the same thing, but it's the communication and the accessibility. If there's a problem, there will always be a problem. That's just the way life is. It's how the problem is fixed. It's really what matters. So when you pick an MLTC, same thought. When you pick a home healthcare agency, even more of a thought, because they're the front line to you.
That's right. That's right.
So always ask what kind of aides do they, a lot of them want to speak English. Where are the aides coming from? What happens if there's an emergency at night? How do you have an on-call service? Are you accessible? Are you nurses? Like for us, we have an on-call service. It's 24/7. There's an on-call coordinator on constantly. The aides are trained that if something happens in the middle of the night, 911 is the first line of defense. So the patient gets taken out. We send our nurses. If something happens in the night, the next morning, our nurses go out and actually do the physical visits. So this way we know, even though the patient's family says, oh, everything's fine. No. You're not a doctor. So we need to send someone in the medical field to make sure this is to protect your loved one. So these questions are very important. So don't only go off of how many hours, go off of accessibility and just having the whole realm, the nursing end of it, the whole realm. Don't go off of only the hours.
Entirely is, and again, well said again, it is a whole picture. The MLTC it's like the HMOs of the 80s, right? That's how it came out. That's how they've grown. They're there to award the hours and provide other services. And we lost you there for good. Now you're all fuzzy.
Oh no.
You're all blurred out.
Can you go get us?
There we go. You're back now.
Oh.
Yeah, there you go. Maybe you just got to keep moving.
I might have hit something.
Now you lost you again. So there we go. So like when we're working with families and there's a need for care, that's good. When we're working with families and there's a need for care, there may be a time for the agency to get in there during the Medicaid application process. And the goal would be to have a home care agency that is also linked up with an MLTC for later on, so we can minimize transitions as Medicaid is implemented down the road. So there comes a time when the agency would be referred, which is, I guess, how it normally happens. It goes agency first and then the MLTC. And you want to be careful that different MLTCs only work with different agencies, right?
Yeah, well, yes. So different agencies have contracts with certain MLTCs. So of course we have, like for me, I have certain MLTCs that I like to deal with, and I like to deal with them again because I can access them quickly. If I need something to be done, I can access them quickly. I'll get them involved with the patient and more than so. We all have our different preferences on that. So yes, so you can go either way, Brian. You can either get the MLTC.
Yep, you can.
And then go for the home health agency, or you can get the home health agency involved in the process. And I would say 90% of the time with dealing with you guys, I'm involved with helping them choose what's best for the client that they're bringing aboard. And usually it's because they have so much knowledge of your clients. So it's easy for me to figure out what they really need. They make your people make my job very easy. I have to tell you that.
That's nice to hear, Charles.
Yes.
Good to hear. So in my field, there are many attorneys that call themselves elder law attorneys. Many of them are good, experienced elder law attorneys, not so much. Um, just less experience or not focusing on this very important field. There are a lot of home care agencies. There are companion agencies. So share with me the difference between those two and what makes your agency stand out from the rest.
Well, of course, me, Brian, but
Yeah, of course.
besides that, okay, so a companion agency is just that. They're not skilly trained. They're not skill trained through and certified, right?
Mhm.
So you always want to go with a certified agency, and if you can do a companion or an HHA, you want the HHA. The HHA is trained better. They understand the emergency situations that need to be done, what to look for. You
Mhm.
know, an aide becomes part of the family. So the ideal aide is to go in and get to know the patient, to know behavior, mood
Mhm.
swings, if there's marks on the patient, whatever it may be, to report it. That's
Mhm.
part of understanding
Mhm.
the patient and
Right.
understanding what the needs are. So where we're different is our communication, our clinical department is unbelievable. When I tell you, as soon as we know that there's something going on in the family, our administrator sends out the nurse right away.
Yep.
Communication, being accessible. We're accessible. I'm accessible 7 days a week. You can ask some of your clients as well. I'll always answer the phone. Weekends, it doesn't make a difference. Unfortunately, because we're not in the office, doesn't mean the care stops, right?
Yeah.
We have we have our school, so we're training our own aides. And
Mhm.
we have our transportation department, so we're able to help the aides get to the cases, and that is benefit us as well. Because if an aide doesn't show up in the morning,
Right.
we know. So we'll know at 7 o'clock in the morning because they're meeting to be transferred at 7 o'clock in the morning. And we have a system in place. The aides come, they check in with the drivers, so we know. So if your client is missing the aide, we have time to react to getting them the help that
Good.
they need.
Good.
So
Good.
that's very different than other agencies out there.
Sure.
So,
So I agree. So transportation, that's a very unique component, and this school.
yes.
So you mentioned earlier the aids are scarce. They were scarce, and hard to come by. We're still seeing some of those circumstances, not as much, gratefully. Um, so between the transportation though and the school where you're training more and more aides, that should certainly help, yes, as far as filling in the gaps and making sure the families are getting all the care they need.
It absolutely does help. Listen, we're all anticipating September to come, right? So September, October to come. Hopefully that will open up the floodgates of people wanting to come back to work. That's
Yeah.
the intention. Um, the, the challenge here was navigating the aides to
Mm.
go to the cases. It's very hard to have an aide go to a case when sometimes they're on unemployment and they don't want to
Mhm.
they don't want to come back. But these are the things that we deal with. So the owners of the company recognize that. So what they did is they opened up the overtime, which was a huge deal for us, whereas other agencies don't. So basically, they said, okay, listen, we're in the middle of a pandemic here. We have issues, we have patients, they need to be serviced. This is something that we cannot put on hold. So, all right, everyone needs to make money to go on, right? For
Mhm.
the lights to stay on or whatever. But we're going to put this to the side and we're going to offer overtime to the aides. It's almost a reward to those who are showing up for work every day. And we're going to bite the bullet on it and eat
Mm.
that
Wow.
until the pandemic is over. So they were wonderful in reacting to that. They seen that there is really no choice. We can't be rigid in that sense
Mm.
when they're in the middle of people needing help.
Mhm.
So we're grateful for them for that.
Sure,
Very much
sure.
so.
Good, good, good. So that was the questions I certainly wanted to ask you, and I'm grateful for the information and for your expertise and your time. Let's see if we have any audience questions. If you do have any questions, folks, feel free to enter it in the Q&A box or the chat box, um, and then we can go from there. All right. It looks like, Charles, you answered everything as you spoke, so we don't have any lingering issues whatsoever.
That sounds great.
That was wonderful. So again, Charles, thank you for your time. Thank you for all that you do. And if people have questions or they want to talk to you directly, how can they do that? What's the best way for folks to contact you?
So they can call us at Valucare, which is 516-345-4777, and my direct extension is 4812.
Mm-hmm.
So anything that they want to ask, I'll be more than happy to help them. Whether they use us or not does not make a difference. We here as we are all patient advocates in our own way. So it does not make a difference what firm you choose. I'm always here to help you. So they can call. And then when I'm not here, that phone, luckily for me, gets transferred to my cell phone. So I'm always reachable by everyone that may need me. Okay.
Great. Well, somebody just stated, love the training you have and the training you give to your aides. So that's a kudos to you. Just popped up.
Awesome.
Good. All right. So again, thank you, Charles. A real pleasure to have you on. Join us next week, please, for our next Wednesday webinar, where we'll be talking about Estate Planning 101. And that's going to be about the basic planning documents and strategies that everybody should have, regardless of age and regardless of health. All right. And then, of course, next month, this time, we'll, of course, have our next guest on navigating your second half. So thank you. Be well, Charles.
It was a pleasure. Thank you.
Thank you, sir. Bye-bye.
Bye-bye.
Bye-bye, everybody.